Is a rash after fever always roseola in children? Have you ever wondered if a rash that appears after a fever in children is always due to roseola? The answer is no. While roseola is a common cause of this pattern, there are many other illnesses that can lead to a similar situation. Roseola, also called roseola infantum or sixth disease, is a viral infection that mainly affects young children, particularly those between 6 months and 3 years old. It usually starts with a sudden high fever that can last from 3 to 5 days. This fever can sometimes reach temperatures above 103 degrees Fahrenheit. Once the fever goes down, a distinctive pink or red rash often appears. This rash typically begins on the trunk and then spreads to the face, arms, and legs. It consists of small, flat, or raised spots and usually lasts from 1 to 3 days. During the fever phase, children may also show signs of irritability, swollen glands, and mild respiratory or gastrointestinal symptoms. In some cases, they might even experience febrile seizures due to the rapid rise in temperature. However, it is important to know that many other viral infections and childhood illnesses can cause a fever followed by a rash. For example, measles, rubella, parvovirus B19 infection, enterovirus infections, scarlet fever, and even certain drug reactions can produce similar symptoms. The timing, appearance, and distribution of the rash can vary greatly depending on the underlying cause. Some rashes may be itchy or appear in different areas of the body, and they might even show up before the fever instead of after. Because of this overlap in symptoms, it is crucial not to assume that a rash after fever is roseola without a proper medical evaluation. Healthcare providers typically diagnose roseola based on the classic sequence of symptoms, which is a high fever followed by a rash as the fever resolves. They also consider the child's age and may perform additional tests if necessary. In summary, while roseola is a well-known cause of a rash appearing after a fever in young children, it is certainly not the only one. If a child develops a rash after a fever, it is always best to consult a healthcare professional to determine the exact cause and ensure appropriate care.